Hi guys, it's your girl Ren and I am back with another midwifery related video. So for today, and it's gonna be a short video. So for today, I did a home birth recently and I am clearing out my bag to sterilize my delivery sets, my delivery tools. So I'm going to show you, I'm going to show you a little bit of what's in my home birth bag. That's the bag that I use to go perform my home births, and it choke up right now because, as I said, I just did a home birth and some of the items were used out of it, and some of them that's in here, they need to re-sterilize. So I am going to show you what I have in my bag. All right, so I have some unused gauze that I'm going to redo, and this bag I have my little mini resuscitator equipment for my baby. So if my baby comes out and my baby isn't doing that well, then I have this little bag here that helps with that. I have some sterilized gloves. I need to put some more gloves back in the bag. I have this is some IV fluids, because sometimes when we're doing home birth, if needs be, we may set an IV access and give the mommy some fluids to hydrate her. So I have this. I need to stock up on some more, put some more in the bag. This I have, it's my jelly for the fetal Doppler, which is the instrument that we normally use to listen to the baby's heartbeat, because during labor we normally monitor the baby and we normally listen to the baby's heartbeat right throughout labor to ensure that the baby is okay. I have some KY jelly. Normally use this to perform my vaginal examinations. This I need to put some more. I need to stock up on that as well. Have some tetracycline eye ointment, which we normally use on the babies as well. We normally put some in the baby's eyes when the baby is born. I have some sets here that were not used. So this is like a little dish that I normally pack them with gauze to use in the delivery. All right, so this is the delivery. This is one of my delivery sets. Right, this is one of my delivery sets. I can open it because it's going to be, this one is going to be redone. It's going to be redone. It's going to be redone, so I can show you what's in it. All right, so I'm gonna show you. So I have my forceps, right, and a kidney dish. We normally put gauze in this with the antiseptic liquid to use for swabbing during the delivery. Have this as well, which is the umbilical cord scissors. So we normally use this to cut the baby's umbilical cord. This is a pinard. This can be used as well to listen to the baby's heartbeat, but most of the times I use the fetal Doppler to listen, because when patients are in labor, it's way easier to use the fetal Doppler to hear what I want to hear. And then this note This I normally put cottons. I normally sterilize cotton and put in that for cord care, or you know, to use on the baby to clean the baby's umbilical cord. Alright, this is an oxygen mask for the baby, just in case we need that. And this is just various tools. This is in this we have an episiotomy scissors, which if needs be we use the scissors to make a slit down there to make more room for the baby's head to come out. So have various tools. This is a small kidney dish, and I have gauze in this one as well. And you know, more tools in this little bag, more tools, and everything is labeled so that I don't have to, I normally wrap my tools individually, because I don't want to wrap everything in one big kidney dish, because if needs be, and if I don't have to go into the actual delivery set, I don't need to go in the delivery set, but I normally pack the tools, some of the tools separately. Yes. And oh, I have this in my bag too. I have a fleet enema, so this can be administered to the patient in labor, just to help to, you know, empty the rectum of all the stool. Because you know, when you do your delivery, it is way better to have a empty rectum. That way, you know, the baby comes quicker. Alright, so there's also thermometers. I keep my thermometers in this small compartment of the bag. And then for this part of the bag now, I have umbilical cord clamps. So we normally use this to put on the baby's umbilical cord. Yes, so I normally have these, and have a tape measure as well, because we normally measure the baby. Baby comes out, we measure the length of the baby. This I have various syringes and some needles. Have an IV cannula. Definitely need to get some more of this to stock up on some of this. And there's other stuff that I have in my car, because this isn't the only amount of stuff that I have. Of course, I have my blood pressure machine. It's not in the bag at the moment, but of course I have my blood pressure machine, and you know, have some gloves. But this is basically it. We normally also, let me see what's up here. Hold on. So I have some masks, and I have my goggles, because you know, during a delivery we normally wear goggles to protect our eyes. So I am going to be giving the bag to the orderly at the clinic, for her to just sort the bag out, wrap the sets, wash the sets, wrap the sets, and for me to get them to be sent down for sterilization, because I have another home birth coming up shortly. Well, I have a few other persons booked for home birth coming up shortly, and I need my bag to be ready, so when the patient calls me, bag will be ready, up to par, for me to do the home birth. So this is just showing you a little bit of what's in my bag, my home birth / delivery bag. And yeah, so thank you for watching. and I will see you in the next video. Peace out. Love you guys.